Good morning, everyone. I am Dr. Kim Nguyen Chi. I'm the Executive Vice President and Chief Medical Officer for BC Cancer, which is part of the Provincial Health Services Authority. I would like to start by acknowledging with gratitude that we are gathered here today on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. They have nurtured these lands for thousands of years, and I give thanks to be able to live, work, and provide care on these lands. We at BC Cancer are very pleased to be hosting today's announcement at the BC Cancer Research Institute here in Vancouver, which I am proud to say is the home to many researchers whose discoveries and innovation have advanced cancer care in BC and beyond. I am honored to welcome the Honourable Mark Holland, Minister of Health with the Government of Canada, the Honourable Adrian Dix, BC's Minister of Health, Taleeb Noormohamed, Member of Parliament for Vancouver-Granville, and Hedy, Member of Parliament for Vancouver Centre. Thanks to all of you for joining us today for this announcement, and I'm going to hand over the podium to Taleeb Noormohamed. Thank you.
Well, thank you so much, Dr. Chi. It feels like we were just here not long ago making another important announcement in support of innovation in pathology. And again, some amazing work that you and your team are doing. So welcome everyone. My name is Taleeb Noormohamed. I am the Member of Parliament for this beautiful riding of Vancouver-Granville. And I too want to acknowledge that we are gathered here on the traditional unceded territory of the Coast Salish First Peoples, the Musqueam, the Squamish, and the Tsleil-Waututh. And as Dr. Chi mentioned, we are here, of course, joined with Minister Holland and Dr. Fry, and of course, Minister Dix, my two favorite health ministers, but also, and I'm getting there, but also, my very dear friend, the President of the Treasury Board, Minister Anita Anand, and of course, Member of Parliament for Richmond, Wilson Miao. And all of us are here because this is an important announcement today that's going to be made, and an important agreement that's going to be signed between the province of British Columbia and, of course, the federal government. This is an important announcement that is going to provide important funding to better support health workers, the person support workers who are critical to taking care of so many in our healthcare system, as well as to providing support and access to life-saving medications. As someone whose family has been directly impacted by rare diseases, the treatments that are available can often be prohibitively expensive. And in this province and across this country, people need to be able to access these drugs in a way that allows their families to continue to be able to live reasonably and also not have to worry about getting the appropriate care. And so today's announcement is critically important for so many across this province who are dealing with the challenge of particular rare diseases. So I want to extend a big thank you to BC Cancer, the Research Centre, for hosting us. Your organization contributes incredibly to supporting health outcomes for British Columbians with innovative treatment and development of essential drugs, treatment, and care. There will be an opportunity at the end of this for media to ask questions. And so I look forward to all of us listening to the announcement ahead and the comments that are going to be made by the folks that are going to be speaking after me. And now it, of course, is my great privilege and honor to invite my friend Mark Holland to come and share a few words. In his public and private roles, Minister Holland has backed healthcare initiatives. He's been a strong champion and advocate for improving healthcare outcomes for Canadians. He has been tireless in his role since becoming the Minister of Health. And he has been in British Columbia many times because we have a tremendous partner here in the province of British Columbia and Minister Dix. And the fact that British Columbia has been at the forefront of working with the federal government on so many of these agreements, and we have signed, I think I've been in the presence of these two ministers signing at least 3 agreements in the last several months, is an indication of the close partnership between the Government of Canada and British Columbia and the importance that we place on ensuring that British Columbians and all Canadians have access to high quality healthcare. So with that, I would like to introduce Minister Holland. Over to you.
Thank you so much, Taleeb. It's a great pleasure to be here with my colleagues, to have Anita and Hedy, Wilson and Taleeb. Taleeb, wonderful to be in your riding again. We've done a few of these in your riding as well, so that works out very well. Dr. Chi, thank you so much. I want to thank the BC Cancer Research Centre for hosting the event, and of course, my colleague and friend, Adrian Dix, for the announcement that we're going to make today. Before my comments on the announcement we'll make today, I'll just give a quick update on the situation on the Canada-U.S. border with dogs. I want to say a huge thank you to Secretary Becerra and to Dr. Cohen, who's the director of the CDC, for their work and through the advocacy of many of our members and certainly the Prime Minister. We're pleased that we're going to have a 9-month grace period now. That means that dogs are going to continue to be able to go across the border unimpeded. The only thing that's going to be required is a positive attestation that you haven't been in a high-risk country over the last 6 months. We're going to continue our hard work to make sure when that 9-month period is over that folks can still take their dogs back and forth across the border. Certainly in my conversations with the director of the CDC and with Secretary Becerra, we both share an interest in protecting our hemisphere against rabies. And Canada is not a source country for rabies. So I think this action recognizes the low risk that Canada represents and how important dogs are to both of our countries. Roughly 1 in 5 Canadians has a dog as a pet, and that same statistic in the U.S. So that's very good news, and I'm very grateful to everyone for their assistance. Minister Dix, you and I have had an opportunity to sign a number of agreements, and it's not a surprise that British Columbia is always first. Anytime, whether or not it was aging with dignity or working together, I've been able to call Adrian. We've been able to say, what is in the interest of British Columbians? How do we find solutions, not problems? And how do we put forward the best agreements to transform our health system? And I think when you look at the working together agreement that we signed, when you look at the aging with dignity agreement that we signed, it really set the foundation for the agreements that followed and laid an incredible path of transformation for health and for partnership. And when we were in Parliament, all of us dealing with the issue of pharmacare, Adrian and I talked countless times. His counsel, his advice was absolutely critical to being able to reach the deal that we reached on pharmacare. I look forward to being back in BC in the coming weeks so that we can talk about that framework, that understanding that we have together on how we can make sure that every British Columbian has access to the diabetes medication that they need, and how we can expand BC's leadership. BC was the one already that made sure that contraceptives were free and available to every woman so that she had control of her sexual and reproductive health, something we want to make sure every Canadian has from coast to coast to coast. Today, we are continuing that partnership. Minister Dix and I are pleased to be able to announce $426 million in federal investment as part of 2 bilateral agreements that are once again the first agreements that have happened in the country. The first agreement will provide more than $232 million to support personal support workers, or as they're known here in BC, healthcare assistants. These healthcare assistants or personal support workers we know well. We saw them on the front lines of COVID doing some of the hardest work of taking care of those that were in need. They're people who do the very difficult work of compassion and helping people as they're going through medical challenges. BC already had met that threshold of making sure that every personal support worker, or as I said, healthcare assistant, was able to get at least $25 an hour. But this money is going to make sure that we go further, that whether or not they're working in long-term care or assisted living facilities, making sure that those workers get a salary that is fair and just means they're going to be able to provide better care, means that they're going to worry less about their personal finances and can put more of their passion and dedication into the care of their patients. It's certainly going to further recruitment and stabilization of workforce. We know how essential these workers are in the delivery of care as well. And it's part of our broader commitment on the Aging with Dignity agreement. That's why this is an addendum to that agreement. And as I say, it's the first agreement in the country. It's my expectation that over the coming months, we're going to be doing many more. But here again, BC is taking leadership. The second agreement, and Taleeb, you were talking about the impact that drugs for rare diseases has. We know in Canada, 1 in 12 Canadians live with a rare disease. And when you start expanding those numbers, the number of family members or friends, everybody has within their circle somebody who's affected by a rare disease. So a lot of times when we hear these disease names, they're unfamiliar to us. or we think of them as being, well, rare. But the reality is they have a tremendously devastating impact, not only just on the individuals who have these diseases, but on their families, because the cost of creating innovation in that space for drugs that can treat these diseases, and then the cost of being able to afford those drugs are prohibitive, leaving people with solutions on the table they can't deploy for their families. So for Minister Dix and I, we recognize that these costs, it's extremely important that we partner. And that's exactly what we're doing today with this $194 million investment. This agreement will support access to new drugs for rare diseases and improve access for existing drugs. Provinces will be able to select based on the needs which drugs for rare diseases will be covered in their jurisdiction, because as we know, each jurisdiction in this country and its associated challenges are different. The first two drugs that are included in this plan are Poteligeo, this is an intravenous chemotherapy drug, and Oxlumo, which is used for pediatric and adult patients with a condition that leads to crystals forming in the body. These crystals can cause permanent damage to tissues, specifically the kidneys, leading to loss of function. So it's essential that families know that they can get access to the drugs that they need to save themselves or their families. And that's why we're looking to work with provinces to make sure that we expand the list of drugs available, as well as best practices and lessons learned for better patient outcomes for those with rare diseases. So I am so pleased to be here to sign these two agreements with my colleagues. It's a demonstration of our continued commitment to work with British Columbia to better health for all Canadians. And with that, it's my great pleasure to introduce my friend and partner in this matter, Minister Dix.
Thank you. Thank you. It is great to be here, great to be on the territory of the Musqueam and the Squamish and the Tsleil-Waututh today, and great to be announcing another important bilateral agreement with the federal government on healthcare. And I think some context is required. In the COVID-19 pandemic, governments set aside traditional differences and did some extraordinary things together. This was particularly true in healthcare. A lot of that work was done by Minister Holland's predecessor, Minister Hedy at that time, and Mr. Duclos, and we did some exceptional things. British Columbia and Canada had some of the best access to vaccines in the world, in spite of the fact we didn't produce them, because of courageous decisions that were taken in advance, in that case, by the federal government, and an extraordinary delivery system that was delivered here in British Columbia that assured that on December 21st of 2020, residents in Hartley Bay, BC, on the BC coast, got vaccinated against COVID-19. And that even in the most recent round of COVID-19 vaccinations, the rate of vaccination in British Columbia was twice as much as it was in the province of Ontario. That was partnership. Federal government taking courageous decisions in advance before vaccines were available to get access to them. And Mr. Anand, you had some role in that, I think. And us putting in a delivery system and other provinces that made a big difference. When Minister Holland became Minister of Health, one of the key messages, we'd come through a whole discussion in this country about the Canada Health Transfer. And I was determined, and he was determined, that we would move forward on these initiatives, that we would bicker less and act more. And that is what we've consistently done. The first to sign a bilateral agreement with the federal government was British Columbia. It is making a difference today for nurses in BC. It's why BC is leading the country and North America in the recruitment of registered nurses. 6,000 more last year to create the conditions that are the best conditions to work for registered nurses. That was a partnership between ourselves and the BC Nurses Union, but also between ourselves and the federal government, led by, in this case, by Health Canada and Minister Holland. We did the same in home support and in our seniors agreement, in our living with dignity agreements. And now today, as you go forward from that, we're doing the same thing on these two very important agreements. And soon we'll do so, I think, with an agreement in pharmacare that will make a very profound difference in this country for women, very profound difference in this country for people living with diabetes. And so that's where we are, and that's what we're announcing today. So today, we have an agreement, $194 million over 3 years, about expensive drugs for rare diseases. And, it's important to understand, I think members of the media here understand the significance of these issues. We've raised them many times. It is a story that we both know. There's a drug, it's not available, it's incredibly expensive. There's an incredibly deserving person who wants to have access to it. And that's the challenge. We have drugs in BC that cost $4 million per person per year. We have drugs for diseases such as spinal muscular atrophy, where those drugs make a difference in quality of life that is profound. The pharmaceutical industry, and this is not bad news, has done a better job in the recent decade with some of the changes in technology and development and life sciences in providing and in researching and developing expensive drugs for rare diseases, but they present very important challenges of assessment, right? Everyone understands that aspirin is a great drug. If you had to pay $1 million a tablet, it wouldn't be such a great drug. And so our jobs as government is to deal with that situation. In BC, just to give you a sense of what that is over the last number of years, $300 million spent on essentially new expensive drugs for rare diseases that have 32 drugs that have benefited 573 people. Right? And what we need to do as a country is to come together and make it easier and also advance the innovation and also give hope to people who are dealing with drugs for rare diseases. And that is exactly what this agreement seeks to do today. More access to drugs, the first two on the list, because we negotiate the cost of these drugs as we go along, so we're not going to provide the full list. First two on the list, Minister Holland has described today, they make a difference, I think, in total for 13 people, but they are drugs of value. So what we're putting in place is better coverage for new drugs, better coverage for existing drugs, better diagnosis and screening, because many expensive drugs for rare diseases, as many of you as reporters know, are for children, and they make an enormous difference. And then an assessment process, which is something that both Mark and I have been determined in all of our health initiatives, not just to put in place new measures, but to assess their value, both in the case of the individual drugs and in the case of the policy. So I am very proud of this initiative. I'm very proud that the federal government, in the budget that they put forward in 2021 at the height of the pandemic, gave value to this, that they said it was going to come forward after a couple of years. We negotiated the agreement first. I know our folks at BC PharmaCare were heavily involved in the development of it. And it is exactly the kind of work we need to do together in Canada. I'm proud of my federal colleagues for putting it in place, and I'm proud of our provincial team for negotiating this agreement. The second agreement is about personal support workers, which is, in a certain sense, an Eastern term in Canada. We typically call people healthcare assistants here, or care aides sometimes, people who are working in long-term care. And this is an area that all of you know, because you've heard me speak about these things before, is of particular importance to me and to people in BC. In BC, for a long period of time, healthcare assistants, care aides, were fundamentally mistreated. Their human rights stripped, subject to repeated layoff. At one time, 10,000 people laid off. The largest layoff of women workers in Canadian history occurred in BC to this group of workers that we need, that demonstrated their profound value in the COVID-19 pandemic, but not just in the COVID-19 pandemic, but everywhere else. So in BC, when I became Minister of Health, we got rid of Bill 29, which was the offending piece of legislation from 2002, and Bill 94, which was the other one. We repatriated in the acute care sector healthcare workers to make sure there was fairness, that people who had worked for 30 years in public healthcare had access to a pension. How about that? When the pandemic started, we were the only province to do this, when we had to say to people who were, because of these circumstances, working in multiple sites, had to work on a single site for safety reasons for residents in long-term care, that we were going to level wages across the sector. That was, in the first year, $165 million to the bottom line. And when you think that that's a lot of money, that's how much under the wage that group of workers was getting. every year in the 15 years before that. And so today, with a federal partner who is as committed to as we are to working people, to people who get up in the morning and got up in the pandemic and went into workplaces that a lot of people were afraid of and cleaned the hospitals and cleaned the care homes and took care of people and became family for people, the federal government and ourselves today, with this agreement, are taking more action to ensure that there is fairness for those workers and that we can recruit the workers we need in the future. As people in BC know, we have an HCAP program. We've recruited 8,400 healthcare workers in our healthcare system through the training in that program. 8,400 new workers, the most successful health human resources program we have ever put in place, and we are building that. You see that with respect to long-term care and to home support and now to mental health and addictions. We are building that because we need those workers, and this is part of it. Ensuring that workers who are represented by the Hospital Employees Union, United Food and Commercial Workers, the BCGEU, but mostly the residents and their families who benefit from their work, are able to be treated with fairness, that we can recruit in the future, that we can build in a population, in a province where the population is aging. We can build a long-term care system that meets the promise we made during COVID, that things would be better. Things need to be better. Things must be better. BC had the best record of any jurisdiction in North America in long-term care during COVID. But there is a debt owed. There is a debt owed. It was not easy and it was hard, and anyone who covered that in the media knows how difficult it is. And today, as the federal government, joining with the provincial government, stepping up to saying to workers, not just pots and pans at 7 o'clock, but recognition for what they mean in a community that is aging, what they mean to people who are living in long-term care, for whom their care staff and their healthcare assistants are families. That's what this agreement said today. I'm very proud to have signed it. Very thankful to Minister Holland and his team. His whole basketball team is here today. I think Hedy's the point guard. Yeah, and so it's my honor to introduce Dr. Hedy Fry, the MP for Vancouver Centre and a cherished colleague here in BC.
Thank you, everyone. Again, I would like to acknowledge that we are on the unceded territory of the Squamish, the Tsleil-Waututh, and the Musqueam nations. My job is to kind of like push everything together. As a physician, I can tell you that it's always been a pleasure for the federal government to work with this particular British Columbia government, because we have one thing in common. We believe fundamentally in Medicare. During the COVID epidemic, as you heard, Medicare took a serious hit because all of the frontline workers were burned out. And so we are left post-COVID with a problem with healthcare being sustained in this country. Working with a province like British Columbia that's committed to maintaining Medicare is a really important thing. And what are the elements? We heard today, we're giving money to frontline workers because human resources is the most important thing. We know we need more doctors. We know we need more registered nurses. Adrian talked about that. But we also need to have those healthcare assistants that take care of people at home. So that's one of the things that we're looking at with health human resources. The other thing is to ensure that we have people getting the drugs they need when they're diagnosed with an illness. And it's not only rare diseases that you heard about today, where very few people are suffering with them, but they're also human beings and need to be helped. But we also talked about a really important thing, two basic drugs for a lot of people in pharmacare. The first step, contraception. Women are going to benefit from that specifically. And a lot of women cannot afford to buy contraceptives every month. So how do you plan your families? That's the first thing. The second thing is diabetes. Not only are we covering diabetes medication, we're covering also both of these in this agreement. We're covering the things that people need. In fact, it's no longer needles and pricking your finger all the time. There are now some new devices that you can put on your arm and you can test without pricking your fingers. Those are essential for people every day to ensure that their diabetes is under control. Those are the kinds of things we're talking about. So health, human resources, the people to work in the healthcare, the medication for people when they're diagnosed as being ill, whether it's rare disease or diseases that are pretty common, like diabetes and need for contraception to be able to build families. The government of Canada is investing $200 billion over 10 years in working together to improve healthcare. And that means all of the things I've just laid out to you. And so that's really important. It's, if we're going to believe in building back Medicare that was severely compromised during COVID. And I just want to thank my colleague Anita Anand, who was the one who made sure that we got all the protective equipment and all of the vaccines that we needed to keep us safe during COVID. So thank you, Anita, for that work that you did. Getting them here on time is really important. So we're talking about also in this province, which we know is important, each patient should be at the center of healthcare. And so having family physicians, and BC is leading on making sure that everybody has access to a family doctor. I don't have access to a family doctor, guys, and physician heal thyself is not a good mantra. So I need a family doctor. I don't have access to one, and yet a family doctor is at the core of making sure that patients have that care that they need, that personal understanding of everything that helps them when they're ill and helps them to get well. So that's an important thing that we're also investing in. And we're talking about mental health supports. Recently, I made an announcement about housing for youth at risk who have mental health needs, but who also clearly need a place to live. And part of Medicare, part of healthcare is about making sure that people have a safe and affordable place in which to live so that they can take care of themselves and get well again. Now, together with BC, we have a number of months ago, we announced a $1.2 billion flow from the federal government to British Columbia over the next 3 years for this particular plan. So British Columbia is getting $1.2 billion to start working on all of these things that will make sure Medicaid is safe and beginning to function again. And then we also worked, you heard about aging with dignity, which means that seniors can age at home instead of having to go into a senior's home. They can stay at home, they can have the care they need from these support workers to come home, make sure they're cared for, they take their medications, they get the food they need, etc. That's a really important thing. We know that seniors actually thrive better when they live at home, in their homes, in their apartments. So once again, I think we're looking at all of the elements of strengthening Medicare. And I'm pleased as a physician to be here to talk about how my government is working with a government like British Columbia to strengthen Medicare for years to come. Thank you.
You're in charge of Taleeb, you're back.
This is exactly it. I'd promised several jokes, but this is a serious day, and so perhaps the jokes will be reserved for later. That brings to the end the formal portion of the speaking party, and I want to thank all of my colleagues, and of course Dr. Chi for your words, and of course for all of us being here together. I think it's an important symbol and a signal to everyone of the commitment that our governments, British Columbia and Canada, have to building a stronger healthcare system and to the initiatives that are being announced today. We're now going to ask, where am I going now? I think we're going to go to Q&A now. So we're going to go to Q&A, and I'm going to turn it over to Deanna, who is going to lead that from back there.
Hey, Deanna.
Thank you, MP Noormohamed. Is it on? So we will now begin with media questions in the room. Nous allons prendre des questions des journalistes dans la salle. If you wish to ask a question, please do so from the floor mic. Please state your name, your media outlet, and to whom your question is directed. You will have the opportunity to ask one question with one follow-up. Veuillez indiquer votre nom, votre média et les destinataires de votre question.
Moving the mic, I like that.
Well, I like to be able to see you when I'm asking questions, so.
It's good stuff.
Vous aurez la possibilité de poser une question avec un suivi. So we will proceed to the first question.
Hi, it's Penny Daflos with CTV News. I just wanted to start out with Minister Dix. What drugs do you expect to be covered? What will you be making a priority? Minister Holland said that it's going to be up to you. Is it going to be a case-by-case basis? Are you going to have a list? Because I think people with a lot of these conditions who have been looking for coverage for quite a long time, they want to know, are they going to be next up to bat, or is it going to be a different process?
Yeah, it's a systematic process. So we're continuing to cover as a province expensive drugs for rare diseases. You'll remember for people living with ALS, for example, the coverage provided for Radicava recently for people living with cystic fibrosis. There's Trikafta. The purpose here is to really advance drugs that might be a while in the pipeline and to advance them and to set them up against an assessment process. I think that's very important. So we listed a couple of drugs, one a chemotherapy drug. Some of those will be in oncology, some of the drugs in question. But for other rare diseases that we saw today, and we'll see that over time. So the first two have been announced, and the process will be this pretty much. We have to negotiate, and it's important to negotiate on price because the better price you get, the more drugs you cover with this agreement. So we've got a list that we've set out, and we're going to go through that list that is initially a list of 12, of which the first two we announced today, which are drugs that otherwise probably would not be available for a year or two in the existing processes that we can advance. That was very important to the federal government. It's very important for them in terms of the life sciences part of this, but really important for patients. So this might be a drug, including the ones today, that going through normal processes, it would have been 6 months, a year, 18 months, where we were assessing it against value. In this case, we can go forward and assess it against value as we're using the drugs. And I think that's important. So you saw the first two on the list today, but we'll be doing that systematically over time, and we have the resources to do that over a period of years. And it could be, if it's the case that the drug does not prove to be effective, that it would drop from the list and others would replace it. But what you have is a process, so that's a key part of it. Part 4 of that process. The third part of that process is improving, especially for children, diagnostic testing, so they can get access to these drugs more quickly. And there may be some drugs that we already support that we'd like to extend or expand. For example, in the case of both Trikafta and Radicava, especially Trikafta, the increasing cost on Trikafta as a drug is that we are expanding the number of people living with cystic fibrosis who can use that drug. So that's the process you're looking at. So we've established now through a very rigorous process, a list, and we're going through the process of negotiating with the pharmaceutical companies involved and getting them to British Columbians.
Follow-up question is just around the wildfires. I know that we're already seeing some evacuations of long-term care residents, et cetera, but also a lot of these wildfires are impacting communities that have already had trouble staffing their hospitals,
right.
Just because, that's been an ongoing issue. Tell me a little bit about what's happening right now behind the scenes to make sure that hospitals are able to stay open, that they have contingency plans, that people are staying safe. What can you tell us about the situation?
Yeah, in terms of, we of course, emergency operations centers in every health authority, but particularly in the interior right now. We evacuated, I think it was 21 residents from Ashcroft earlier this week. And in that case, those residents went to Salmon Arm. So it's a significant thing. Just to put it in context, last year, 1,000 long-term care residents, 1,000 had to leave and had to be evacuated from their long-term care home, which is a significant thing. Last night and today, we're evacuating care homes in and around Williams Lake. And sometimes it's hard for communities to understand why we're evacuating earlier. The reality is with a care home and to a degree in acute care, it requires longer to evacuate. So we have to have a lower standard for evacuation in care homes. So last year it was 1,000. A lot of that, you'll remember, was in the Okanagan, but in other areas as well. So first in Ashcroft this year and in Williams Lake, there are care homes being evacuated on the BC border on the Alberta side. Those ones at the moment are going to Alberta care homes, although we, of course, would be open to supporting our friends and neighbors as we were last year when we took patients from the Northwest Territories, you recall, who came in through the airport. So with respect to emergency rooms, that's a full-on effort across the system. We've had a very successful year in recruiting family doctors. 831 net new since we launched the longitudinal family practice plan. But we got to be open 24/7, 365 everywhere. And so you're seeing systematic action, and it's different in different communities. Fort St. John, as a community, for example, has 28 doctors, family doctors, but they're doing different things and there are different circumstances. That would be different than another community that's much smaller that has 1 or 2. But it is a full-on effort every day. We are assessing every single day and to fill every possible vacancy there is in emergency rooms to make sure that they're kept open. We have new, of course, supports for doctors and nurses in their recruitment, but also new arrangements with locum doctors. We're transforming a lot of our emergency room from fee-for-service, which is hard for overnight, you don't get enough patients, to alternative payment plan models. So we're doing all of that, and it's an everyday, and the new day started today. We worked hard yesterday, and in fact, late yesterday, we were able to fill some important vacancies, and we're just doing that every day. So there's the provincial policies that I think are proving effective in the long run, but also we're just working it every day in every one of those communities because it's critically important, I think, to public confidence in the healthcare system that emergency rooms be open, but it's also a very, very stressful summer. It's going to be a stressful summer. I just say the personal support workers, we talk about healthcare assistants, Mark, and I can't tell you the work that was done, the letters we received from people from the Northwest Territories who came down here, were met in the airport by ambulance paramedics, who were brought to long-term care homes like Queen's Park and New Westminster, who stayed there and were supported by healthcare workers, and what that meant to them and their families, what it means for the healthcare workers to have to move people from a site. The majority of people in long-term care live with dementia, and about half of people in long-term care, for a whole bunch of complex reasons, the changing society, don't receive family visits. And so those healthcare workers frequently travel from last year from Kelowna to Vancouver, this week from Ashcroft to Salmon Arm, when their own homes are under pressure from those self-same fires that are leading the people they care for to be moved. All I can say is that it reinforces the work that the federal government, the provincial governments are doing to support those very workers who are doing this work at this time.
Adrian, Jack Morse, City News.
Jack, how you doing?
I'm doing all right. The question I have is on that number, 13,000 healthcare assistants. I want to know if that number is a commitment to 13,000 new over 5 years, or a commitment to improve working conditions, wages, and if it is a commitment for new, where are they going to come from? We know that hiring is the biggest challenge in healthcare right now.
Well, it's why we have an HCAP program in BC that's hired 8,500 healthcare workers, to whom many of this will apply in many cases. 8,500. We established it in the pandemic, and it's been the most successful program. You can do it. You can do it by connecting to high schools. You can do it by really what are work and training programs combined together, like HCAP. We've demonstrated that, and in fact, that model has now been expanded. So 7,500 or so of those workers are long-term care. Another 1,000 are home care, home support, which is a whole class of workers we need to support as well. That's all of the ambitions of people living at home being supported require workers, right? So that's work. And to mental health and addictions work, which is increasing an important work in the community. So that money isn't for new, but it will produce new, right? Mm-hmm. You can't have a system, ultimately, it's problematic, where you have one group of workers. So we have 30,000 long-term care beds in BC. About 9,000 are public health authority owned and operated. A number thousand beyond that are run by organizations such as Providence Healthcare, which are essentially health authority linked, right? And then the majority are public beds in private, either for-profit or nonprofit facilities. You can't have a situation where you have, this is why we took the action in the pandemic, one group of workers disproportionately being different than another group of workers, because the flow will be away from the public beds that are funded in private facilities. There'll be a flow away of workers. So this is part of making sure that we can recruit and that we can recruit across the sector. And one of the unique things as well is the partnership we've had with the BC Care Providers, which is headed by my predecessor, as you know, and others in working through these issues in the pandemic. So that's an important thing to do. And so yes, it does that, but yes, it's profoundly linked to remuneration. I mean, you know that healthcare workers, in some cases, because of Bill 29, because of right-wing politics in this province, and treating working people who go to work and work a long day and then have to do another shift at another place, that salaries were cut to $10 an hour in this province, in many cases, that they could flip contracts at will, get a contract, get a new provider, and then the contract would be flipped. Well, those days are over in BC, but they don't make any sense anyway. Even if you agreed with the policies that Mr. Rustad and Mr. Falcon put in place in BC, even if you agreed with them, they wouldn't make any sense anymore when we're trying, as you say, to recruit healthcare workers. So this is going to help us an awful lot, and I think represents a really thoughtful approach. We raised this with the federal government. They were totally on board with supporting working people. They understood exactly what we're talking about, and we really appreciate our coming together on this agreement.
Okay, so do you expect that this funding announcement will mean more healthcare assistance above and beyond the various pathways that the province is already working on to get new healthcare workers trained?
This is fantastic news today. I'm so proud of it. It's in the line of all those other initiatives we're talking about. And it's understanding, because frequently, and we have strong measures for doctors, and Mark and I yesterday spent a lot of time talking about how we can make that even better. And a lot of time for nurses. Our main agreement was about nurses and nurse ratios and making this the best place for nursing in the province, and the federal government was there for us on that. And major work with health sciences professionals, and we doubled the number of full-time ambulance paramedics. If you're in long-term care, the most important group of workers to you on a daily basis are healthcare assistants. And, you know, it is, I just say this frankly, it's good to be working with people who understand the value of that, because that's fundamental. It's part of the reason I ran for office for my party in 2005. And this kind of day is a huge day for workers in BC. Thank you.
Thank you. Any other questions in the room? Yep, go ahead.
Tiffany Troughton with BC Care Providers Association.
Hi.
Hi. Minister, BC is already providing wage leveling for support workers, and the funding would subsidize the province to do what they're already doing. Alternatively, could this be used to continue visitation funding?
Sorry, happy to talk to the BC Care Providers. Of course, we have our tables to do that, and I talked with Minister Lake. I think today's announcement is really good because it's an investment in the long-term care workers that we need to invest in over time, and that's precisely what the announcement's about today. It's now that we've got it done and we've got it signed, we'll be able to sit down with you as an organization and as an interest group in this area and work on this area. So look forward to meeting with Terry about it. Say hi to him for me.
Will do. Thank you.
Thank you.
Thank you. Any other questions in the room before we go over to Zoom? Last call? All right, over to you, Anne.
Thank you, Dina. We'll now proceed to questions from journalists online on Zoom. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and the media outlet you represent. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes un journaliste et désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et une de suivi. Sauf si je l'ai mentionné, veuillez indiquer votre nom et le média auquel vous représentez. The first question is from Jillian Piper from Global News.
Hi there, this question is for Minister Holland. Thank you for taking our questions today. It's a little off topic, but my first question for you is, multiple independent scientists say that Canada's pesticide regulations are too heavily swayed by industry lobbyists who may not have Canadian safety top of mind. How concerned are you about industry supplied data influencing Canada's pesticide regulations? And are those concerns explaining why your department is proposing changes to the regulations?
Well, one of the things that when I talk to my international counterparts, there are many jurisdictions that are enviable of the fact that Canada separates its food inspection and its pesticide regimes and places that under a health mandate rather than an agricultural mandate for the very reason that you just said. Of course, we have to be concerned with industry. We want industry to be successful. We want them to be able to produce high-quality food at affordable prices, but it's absolutely essential that we make sure that folks are safe and that the food they consume is safe. And I think Canada is known globally as getting that balance right. As health minister, whether or not it's an approval of a pesticide or whether or not it's on regulation of food, we're always trying to get that balance right. We always first ask, is it safe? Is it healthy? Are we protecting Canadians' health? That's the mandate of Health Canada. But in the second instance, we do work with industry to hear their concerns and want them to be successful, to make sure that our processes are not overly bureaucratic or slowing them down unnecessarily. So I would say Canada is seen around the world as getting that balance about better than just about anybody else out there. I think you'd be hard-pressed to find a jurisdiction that does it better, but I'll admit it's a difficult balance. Those two things often do come in conflict with one another. It's why we make sure that these processes are science and evidence-led and happen at arm's length.
Thank you very much for that. And my follow-up to you is, what is your message to Canadians who say they've gotten terminally ill from using pesticides deemed safe by Health Canada?
Look, I think there are different instances, and we would have to take a look at it. We have to be informed by data. There have been examples in the past where things that we thought were safe and the evidence told us were safe, in the passage of time, we learned were not. That is the benefit of a science evidence-based approach. But it does mean that sometimes things get wrong, that we get things wrong, that the evidence and the data that we have and that the science that's in front of us, it doesn't give us the full picture. And to folks who are affected by that, obviously, I'm devastated. Putting it very personally, I can't imagine being in that circumstance, losing a family member or having somebody get a deadly condition as a result of not having the right information. But I think if I were in that circumstance, either as being personally affected or my family personally affected, I would want to know, was there a rigorous, independent scientific process? Were the decisions that were made resting on that independent best science and best evidence? And if the answer is yes, then what other choice do we have? We have no other option in this country other than to rely on science and data. And I extrapolate that to all things. We're in a time of incredible complexity. Anybody who tells you what's going to be happening in this world in the next 2 weeks, just take a look at what's happened in the last 2 weeks. And so the only way you can guide yourself through that kind of change and that kind of tumult is by relying not on feelings, not on emotions, but on science, data, and evidence. And I think when we do that, we can look back at the decisions that we make and say, were they the most informed by the evidence that we had at the time? Did we, as you say, yield to a particular interest, be it economic or ideological, and therefore made a decision that was wrong on the basis of science and evidence? That is inexcusable. And I think there are forces that would see our world move in that direction, and we must stop them.
La prochaine question est de Rafi Boudjikanian de CBC. The next question is from Rafi Boudjikanian from CBC.
Hey, good afternoon or good morning for you, rather. My questions are for Minister Holland. Mr. Holland, I'm just wondering, what is your message to Canadians who went out of the way and paid hundreds of dollars to make sure their dogs have the proper documentation to show that they're rabies-free, and now they're finding out they did not need to do that?
Well, making sure your dog got its vaccinations up to date is just a good idea. So to anybody who went and got their shots or made sure that, hey, did my dog get the proper vaccinations? Well done. You did an incredible service to the country and to public safety. And now you're still able to cross the border and keep your plans. So I think good news. Look, I had a very good conversation, the last of which was on Friday evening with Dr. Cohen, who's the head of the CDC. They were trying to address a global issue. There were some impacts to Canada. And of course, we tried to give people the best information that we could. At that time, that's what those regulations were. I said at the time that we worked through to try to improve the circumstance. And fortunately, we were able to get there for this 9-month grace period. And I'll continue to work with Secretary Becerra and the director of the CDC, along with my colleagues, to make sure we have intelligent, sensible solutions going forward. But vaccinating your dog is always a good idea.
Thanks. And my follow-up is about that 9-month grace period. I guess I'm wondering, do Canadians need to worry about the rules changing yet again?
Well, as I said, in a global world when you're dealing with other jurisdictions, change is always possible. What I think Canadians should expect from their government is that we are staying very close with our counterparts in the G7 and beyond to make sure that Canadians are fairly and reasonably treated when they travel and when they exit and enter our country. And this is an example of an excellent partnership. Look, things are going to happen. Mistakes get made. The question is, how do you respond to them? And this is an example. In a very short period of time, we were able to work with the American administration to get this right, to make sure that Canadians were fairly treated. And I think Canadians should have an expectation that their government in other circumstances would comport themselves similarly.
The next question is from Kelly Gren from the Globe and Mail.
Hi there. If you can hear me okay, my question is for Minister Holland. The Canadian Medical Association released a draft policy paper today on private-public care, and one of the things they called for was a ban on user fees for primary care provided by professionals other than doctors, so namely NPs and pharmacists. Your government and you have promised to put out a Canada Health Act interpretation letter on this. That's been in the wind for a little while now. Can you tell me what's holding that up and what you're planning to do on that issue?
Absolutely. Well, I can say that whether or not it's with Adrian or with other health ministers across the country, there has been an ongoing conversation about the interpretation letter. The Canada Health Act, we have the responsibility to administer it and to amend it, but we also have a really important responsibility to work with provincial jurisdictions to get it right. And one of the things that's absolutely sacrosanct, I know it is for Adrian, it is for myself, is to make sure that our public system remains public, that Canadians are not in a circumstance where they can't afford care, where we have two tiers. And there's a couple of reasons we don't want that. The first is just a simple matter of justice. We can't have a situation, we're talking today about the important announcement on personal support workers. If a personal support worker can't afford the care that they themselves are trying to give to somebody else, that is fundamentally unjust. And in the second order, we know that systems that allow privatization, we see a migration of dollars to the most profitable parts of healthcare, and we see a stripping and a desecration of public care, where the most expensive procedures and the most vulnerable people are left to an ever-worsening system. That leads to poorer health outcomes. So to say we are very committed in short order to updating the interpretation letter. We had a meeting with our various deputies that took place just about 2 weeks ago now, and that was a very productive meeting. But I don't want to do it in a way that's injurious to federal, provincial, and territorial relations. I think there's a way to do this collaboratively, and that's why it takes a little bit of time.
Okay, if I have a follow-up if I can, and that's about the listeriosis outbreak that killed a couple of Canadians and has sickened some others. The factory where the listeria contamination began was apparently a third-party production plant, and Danone has refused to release the name and location of that plant. Why is the CFIA or another federal agency not releasing the name of the plant where the contamination began?
Well, first of all, this was a terrible tragedy, and Canada has an exceptional record in food safety. The Canadian Food Inspection Agency does, I think, the best job of any agency in the world in protecting the Canadian food supply. But this was an unacceptable circumstance. The loss of life as a result of food contamination is something that should never happen in Canada. To the releasing of the name, I know that there are legal issues involved in that, but I think your question is a fair one. And so I have to kind of adjudicate and navigate those legal matters, but let me get back to you in short order because your question is fair.
Those are all the questions on Zoom. Back to you, Dina, for the signature portion.
Ooh, the signature, the difficult signature round.
All right, so now we're going to ask Minister Dix and Minister Holland to take their seats. We'll all join you, and off we go.
too.